Currently, there are 6 family physicians. I'm one of them. We all have our practices within the hospital, and we also provide inpatient coverage for our own patients. And we are also part of a group of 7 physicians who take turn at providing inpatient care for our medicine ward. Those patients come from different places. There are patients who don't have family doctors at the hospital, patients who don't have family doctors at all, patients who can be transferred from nearby hospitals who are at overcapacity, or patients who just need a bit more time in a hospital setting or convalescence following care at other hospitals such as Cornwall, Hawkesbury, Winchester, Ottawa.
What do you recommend, Dr. Thompson, for our patient here at Glengarry?
Well, I'm a little concerned with the decreased air entry.
One of the benefits of telemedicine is repatriation. Repatriation is when a patient goes outside of their local community to receive specialized care, but then returns to the local community in order to continue the care. Through OTN, or telemedicine, we can provide a comfort level for patients to come home to their home hospital. One of the programs that we use here at the hospital for telemedicine is for those patients that are awaiting surgery. So when they come in before, they always need a preoperative assessment program. So that would be 2 trips to Ottawa instead of 1. So the first trip could be to their local hospital. They would come in and use our telemedicine system here. We could do the blood work here, their cardiogram here, listen to their heart sounds with the stethoscope, look at the back of their throat with the camera to make sure that there are no issues with their intubation, and all of that information is transmitted through the system. They also get to talk to the pharmacy department, the nurses, and the anesthetist.
Hi, Greg, how are you?
Yourself?
Good, I'm going to help you out today.
We service patients from Stormont, Dundas, Glengarry, Prescott, Russell, Akwesasne, Cornwall, and Hawkesbury.
It's a multidisciplinary team. We have the physiotherapists, the nurses, nursing manager, myself, and whoever is involved in the care talking about the patients. The physicians come to bullet rounds as well. So everybody's on the same page, everybody gets the same message, and we all know basically what the plan is. So my role is to assist patients in their discharge planning home. I assess the level of care that they need, and I refer accordingly to home care services, whether it's a personal support worker, nursing, therapy services, things like that. I'm also involved in the rehab process as well, and transitioning into another facility if need be.
Glengarry Hospital has been in collaboration with the Ottawa Heart Institute's smoking cessation program for the last 10 years. And as part of that collaboration, we have a designated smoking cessation coordinator here at the hospital, which is my role. Patients are identified through our admission process. So once they're admitted to the hospital, they do a general admission interview with a nurse. And during that process, the patient is asked if they have smoked within the last 6 months. And if they reply yes to that, it triggers a smoking cessation coordinator consult. We can discuss quit strategies if they would like to quit smoking. And we also offer, through the Ottawa Heart Institute, a follow-up program once they're discharged from the hospital.
Knock, knock. Hi. Hi there. Hi. How are you?
We do rounding of various levels. The nursing supervisor rounds 3 times a week on the inpatient units, and then we do senior management rounding on a minimum of 4 patients per week on the inpatient unit, and a minimum of 4 patients per week in the emergency department.
Are you satisfied with the treatment your mom has received to date?
Yes. It was a great experience to see the whole family come together. The patient said it felt like she was at home. She felt like the staff were like a family here as well. Of the suggestions from patients and families, patient and family communication boards that talk about how the patient would like to be addressed. Would they like to be addressed as Mr. or Mrs. or by their first name? It gives the names of the healthcare provider, the nurse for that day, their personal support worker, their physiotherapist, their doctor.
So have you had your prescription filled since you've been home? Were there any questions that you had? When patients are being discharged, there's a lot of information given to them all at once. New prescriptions, doctor's appointments, follow-ups, could be labs or x-rays that they need to come back for. It's nice for them to hear back from us within a day or two. If they have any questions or didn't catch anything, we give them that information again.
Like, they were so great, and they were really busy because they were filled to capacity. And yet they were always cheerful and, let me know, is there anything else you need? And wow, I really, because, you're worried, you're stressed, you're worried, and they were there. They were great, really great.
That's right.